Dr. Linda Animashaun's story is one of faith, courage, and rediscovery. From growing up in a Ghanaian household shaped by discipline and service, to choosing public health over medicine, to leaving behind job security to build a consulting business aligned with her purpose, her journey reminds us that courage often begins with permission to want. In this episode, we talk about integrity in evaluation work, the power of saying both no and yes with intention, and the radical act of dreaming, especially when the world tells you not to. You're listening to the Courageous Public Health Podcast, episode 31. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Dr. Linda Animashaun is the founder and principal of Amammere Consulting, LLC, an equity-focused evaluation firm that advances public health through community-rooted insights and action. She has over 15 years of experience in health equity research and evaluation, working with federal agencies, nonprofits, foundations, and community-based organizations. Her work centers on the social determinants of health, with a focus on chronic disease prevention and control, nutrition, and community engagement in historically marginalized communities. Dr. Animashaun specializes in designing and implementing qualitative and mixed methods evaluations that reveal the story behind the data, empowering organizations to understand, strengthen, and sustain the impact of their work. Known for her collaborative, culturally responsive, and community-centered approach, Dr. Animashaun has developed data collection instruments, led interviews and focus groups, and produced accessible case studies, training materials, and findings reports for both technical and public audiences. She also supports organizations through facilitation and strategic planning, helping to align their efforts with equity goals and community priorities. Deeply committed to uplifting community voices, she views evaluation not just as a learning tool, but as a vehicle for equity and lasting change. Dr. Animashaun holds a BA in African American Studies from Columbia University, an MPH in Behavioral Sciences and Health Education from Emory University, and a DRPH in Community Health Behavior and Education from Georgia Southern University. Are you ready to be inspired? Let's listen to my conversation with Dr. Linda Animashaun right now. Welcome to the podcast, Linda. So good to have you.
Thank you. I'm glad to be here. I appreciate the invitation.
Yes. Oh my goodness. Absolutely. So we'll do our quick shout out to Simone McPherson, who suggested that I reach out to you, and I'm so glad that she did.
Yeah.
She's great. And remind me how you know Simone.
So Simone and I were on the executive committee for the Atlanta Area Evaluation Association. I think in 2021. So
Yeah,
that is how I've met her, and then we've reconnected more recently as well. So that's been really nice.
beautiful. Yeah, yeah. I find it really. It's just been really helpful. Not even helpful. It's like it's been a really good idea for me to ask my guests to recommend other courageous women
Hmm.
to reach out to invite to the podcast. It's I love the like it's almost like a social network, like
Yeah.
it grows and it's great. So thank you, Simone. Thank you
Yes.
for the
Thank you.
recommendation. So let's start by having you introduce yourself.
Hello, everyone. My name is Dr. Linda Animashaun. I am a child of the world. I guess I can say my family is from Ghana originally. I grew up in New Jersey, was born in Germany, never lived in Ghana, although my accent sounds like I did. And I I got into public health accidentally. I just observed what was going on in my world, thought had an interest in health in clinical medicine because that's what I knew about. But then I learned what public health was through my experience and my observations, and I feel like this is in very much in alignment with where God would have me to be. So I'm very pleased to have worked in the field of public health for over 15 years now, and
Amazing.
my work is primarily in health equity. I do evaluation as mentioned as to how I know Simone. So a lot of the work that I do is community engaged, health equity focused evaluation to clarify for organizations how their programs are working, if their programs are working, how to improve in areas where they need improvement, and then also to support them in promoting their the efficacy of their programs to other people who might participate, and then funders as well. So, using leveraging evaluation findings to also generate funding for organizations.
Oh, that's so incredibly important. It's so important. And I imagine it's even more important right now when funding is extra challenging.
Yeah, yeah,
Yeah, when our programs work, we want to be able to say that. And when our programs, yeah, need a little a little boost, we want to know that too. So that's great. That's
yeah.
great. So let's jump right into our first question. I'm excited to talk to you about courage, which I always like to differentiate between bravery and courage. So bravery is taking up space without fear, and courage is taking up space despite fear. So I would love for you to share with us some examples of from your professional life and your personal life of courage, where you've acted courageously.
Thank you. Yeah, I guess I'll start with my personal life rather. I
Okay.
have already kind of discussed how I came into public health accidentally. Much of it was related to my upbringing and my family experiences when I was in high school. I'm the oldest of three girls. And when I was in high school, my mom, who was the breadwinner of our family and worked as a nurse in a prison, she got into a car accident and was unable to work or even move around for a long period of time. It and so I had just gotten my driver's license. I am going and doing the grocery shopping for the house and the things of that nature. And I was able to make observations that now with a lower income than we had before, the groceries, you know, the places where I could go to groceries to afford for, on behalf of my family were not uh, available. There, the places that I went, there were no produce there. It was mainly refrigerated TV dinners and all the ultra processed foods. And
Yeah.
that it was there when I was thinking, this is not right for people with a lower income to have access to this and not fresh foods as you would see in other communities, more affluent communities. And so that got me started. But then when I went to college in New York City. Um, and on campus, which they called Morningside Heights, they, you saw all the fresh markets and all of that. And then when you went a couple avenues down in Harlem, New York, and there's a lot going on there, Harlem versus Morningside Heights. Um, you saw all the fast food restaurants. You saw the grocery stores that had not so great for produce. And at the time, I'm older, and so at the time there were not healthy corner stores. There were corner stores that had chips and
Yeah.
colored drinks,
Yeah.
not even like soda or juice, but color.
Right.
And, I was starting to make the connection. Look, in communities, the Black and brown communities and lower income communities, this is what the environment looks like. And this is what their health outcomes, preventable diabetes, hypertension, all of these things that they're being affected by. We are being affected by. And so it was around that period of time that I got to understand public health. And that really became a big area for me and particularly health disparities, health equity. And so the courage in that was telling my mom, a Ghanaian woman, and my father, a Ghanaian man, that I will not go to medical school, but I will go to, I plan to work for a few years and then move into public health. Um, and by working for a few years, I did teach for America. I taught in Houston, Texas, which was also another experience of courage. Being a teacher
Yes.
is not for the weak at heart. Uh,
Yes.
and so that was, and also going to a city that I didn't know anybody. That was also um, an act of courage. And so from there is when I then transitioned to public health and came to Atlanta, where I am now, um, to pursue my MPH. So I guess personal and professional kind of go into
They're related.
intersect a lot.
Yeah.
But and then professionally, I work in I work in public health now. I'm particularly in health equity. There are going to be times where if you are actually passionate about health equity and want to be effective in your work, you're going to have courage. You're going to have to say the things that people don't want to hear, that are the truth, at least the truth that you're aware of. And so, areas in that regard where I've had to speak up, or I had to say things in my jobs where I didn't know how it would be received, but I cannot not say it. And
Yeah.
so those are some areas of courage. For example, when you're working in communities and people start to see the findings of your results, and they
Mhm.
kind of want to massage it to make it look pretty.
Yeah.
um and you kind of have to say, no, that is not what the community said. This is what the community said.
Yeah.
And my role is to reflect what the community said, not what you want it to look like.
Yes.
And so, there's, I guess, courage slash integrity there.
Oh,
Because I
yeah.
don't want to go back. I would have to then exhibit more courage to go back to the community and tell them
Yeah, really.
the thing that I told them. I don't make promises, but I at least tell them I'm going to share what they said and what their recommendations are. And if I didn't do that, I can't go back to the community and show my face and
Yeah.
feel okay about that. No. So, you know, that is
You're
that is my
this connection between courage and integrity is that makes so much sense. It makes so much sense. It's like sometimes to be in integrity, we have to, push through with some fear.
yeah. And so another area, I guess, professionally where
Yeah.
gotten some more I've had to exhibit courage is after I, did my MPH, I worked for a few years. While I was in my MPH, I thought, okay, I do want to do a doctoral program, and I learned about DRPH programs as opposed to PhD programs. And so
Yes.
I was like, okay, I want to apply. And as I was starting to apply when I was in my master's program, I realized a lot of these programs want people with work experience beyond your master's before
Yes.
applying. And so
Yes.
I said, okay, well, I'll do it. And then I kind of forgot about it. But then there came a point, maybe in year 5 of working after my master's, where I said, okay, I think it's time. I was feeling it in my spirit that is time to pursue this again. And that was hard because my parents were always afraid, oh, you get too comfortable, your salary. I will say that my salary was not a salary of comfort. It was not. I wasn't making that amount of money that I would be that comfortable. I was living and I was, able to
Yeah.
pay my bills and save, but it wasn't, I wasn't doing,
Their fear was unfounded.
yes. And so, but it still took courage because I had to apply. I had to, pursue, do the GRE again. I had to, the level of comfort was more about the lifestyle than it
Yeah,
was the money that I
that
was,
makes sense.
and you know and so, but I was able to do it. And because I also had to move because I
Yeah.
was in a different, I wanted to
Right.
stay in Georgia, so I went to Georgia Southern. Shout out to Dr. Ramona Lawrence, who was also
Yes.
she was my
Yes,
best
she
professor.
was.
Loved
She was
her
she was the second guest on the podcast.
yeah.
So, yeah, yeah, love
um
her.
and so I had, that was an experience of courage.
Yeah.
um and now, more recently, I would say, I've I graduated, went back to work, transitioned to another company. While I was in that company, I started my own independent consulting firm, and I did that with the knowledge of the company. And last Thanksgiving, almost a year ago now, I went full time independent. So that is
So
another area of
exciting.
courage because
Yes.
raised to be an entrepreneur. I just told you, my parents were like, go to school and get a job and
Yep.
work for someone. And now I'm learning about how to not necessarily how to do things on my own, but it's more about how do I dream and do the things that I like to do, and pursue what I want. And how is it even so that I can want? I'm
Yeah.
so used to executing other people's visions, but now it's me that can have a vision and pursue it.
Yes.
And pursue it in the way that I would like to pursue it. I can start work at 3 p.m. if I wanted to.
That's right.
I could, whatever. So, obviously, there's challenges. I mean, I love working independently.
Yep.
There are ups and downs to it and all
Of
of that.
course.
But for me, the work of courage was not necessarily to build up my professional skill set, but it was really to change my mindset about it is okay to want. It is okay to dream. And in fact, since the last time you and I spoke, my
Yeah.
birthday passed, and um, my husband and my bonus daughter and I, we were in California. We were in your neck of the woods.
Oh, you were. Oh, great.
Well, San Francisco. I don't know if where
Yeah,
exactly.
yeah, we're close by.
So we went to Sausalito Island, and my husband was talking about, um, oh, we will retire here, and I was thinking about all the reasons why retirement in San Francisco is not the most practical thing.
Right. It's not optimal.
And you know we talked further about it, and it was really like, I asked him and but my bonus daughter, I asked them, well, at what point is it a dream and at what point is it a delusion? And my bonus daughter, who herself is awesome, Cherie, thank you, you're wonderful. um she said, well, to be a business owner, you kind of have to be delusional.
Yeah, yes.
And
Oh.
I just thought that was like, okay. And she is a bit like, she is still in college, but before she even started, she was a business owner, and she started
Wow.
her own work, her rising. So
Amazing.
to hear from her and to learn
Yeah.
from her is, but yeah, I have to learn how to be delusional.
Yeah.
I have to learn how to,
Yes. Yes. Oh my gosh. Okay. All right. I have so many things I want to say.
yeah.
First of all, I love the phrase bonus daughter. I've not heard that before, and that's really lovely. And then, yes, I mean, the idea of wanting is so powerful, and I feel like wanting is like a form of resistance. You know,
Yeah.
it's a I mean, I and it, any of our listeners, if you haven't heard the first episode of the podcast, it's a solo episode where I talk about why I started this and who I am and sort of the background piece. But there's a whole piece in there about realizing that I also didn't know what I want, and that one of my coaches challenged me to make a list of 100
Mhm.
desires, right?
Yeah.
And I it was really challenging, and I didn't realize the extent to which I did not let myself want.
Mhm.
And once I let myself want, oh my gosh, step back. Like, there are a lot of things. There are a lot of things. And it's also, for me, there have been a bunch of things that I want. And now a couple years later, I'm like, oh, like I created that for myself. I
Yeah.
did that. I wanted that. And now I've created that for myself. So I can cross that off the list. Or things that I'm like, I thought I wanted that. And now I'm like, I don't really want that. I want something else. So I get to cross that off the list. And some things that, I still go for it. But anyway, I love the idea that you are like leaning into what do you want. And it's okay to want something and not create it for yourself. Like it's okay to want to move to Sausalito
Mhm.
for retirement and not move to Sausalito for retirement. Like that's fine too. Like, but the wanting is not about what's feasible or what's, like the logistics and all that stuff. I mean, wanting is just about what's inside.
Yeah. Yeah.
So, yeah. Well,
But the
now
other
I kind of,
thing is, you can, you can really, it could be a possibility.
yeah,
It could, I
yeah,
well, it could be a possibility.
it
So
could be a
not only that,
possibility.
it's the wanting, because I've been, I guess, not necessarily explicitly told, but implicitly told that don't want too much.
Yes.
don't want too much. So yeah, it is okay to want, and if you come to to that realization, if it comes to fruition, even better, because you didn't even know that you could desire that
Yeah.
big.
Yeah. Oh, yes. I mean, now I kind of want you to move to Sausalito because that actually is like, it's like an hour away from me, selfishly speaking. So I'll add that to my things, my list of 100 desires for Linda and her family to move to Sausalito when you retire. Oh, yeah, that is great. That is great. Okay, so I wanna kind of transition into the second question,
Mm,
which is, and you spoke to this a little bit already, but this idea of claiming and expressing your power, especially in spaces where it's not always welcome.
mm.
And so I'm curious about kind of how you express and embody your power, as a Black woman doing the work of public health.
Yeah, and I feel in general, as a Black woman, there are not a lot of spaces where you can just be welcomed, and the fullness of you is accepted as is. And so I'm learning how to resist and be my full self, exist as I am, learning that my flaws are my flaws, and also, you know, I have a lot of strengths too, and I have a lot to contribute. Even coming here, my initial thought was, well, what story do I have to tell? I'm not sure. But I'm learning that we all do. We all have stories. We all have something to share. And but we are not allowed to exist as we are unless it looks a certain way.
Right.
And so I am another, kind of going back to the first question a little bit,
Yeah.
but another form of courage is to be who you are, flaws, beauty, ugliness, and all,
Yep.
and do not worry about whether or not you will be accepted. Just
Yeah.
be who you are. So, um, that's something I'm learning. I've spent a long part of my life trying to be who I thought I was supposed to be, or who I was told I was supposed to be, and I'm now learning that I can be who I am, which is not that drastically different than who I thought I was supposed to be, but it's not exactly.
Yeah.
And I've suffered in the spaces of discrepancies,
Yeah.
and I'm learning how to release that, and allow myself to just be who I am. So, but in doing so, obviously, you know, I do, again, speaking your truth, whatever that may be, um, saying, again and again, as a business owner,
Yeah.
you you are the one who sets the tone for with your client.
Yeah.
You don't have to. I mean, yes, you come to an agreement as opposed to following whatever they say, because there might be times where you have to say no, and you have to
Yeah.
be okay with saying no, and they have to be okay with you. If they're not, then maybe it's not the best fit.
Yeah.
And
Yeah.
but you fire your clients too if you.
Yeah. 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 And I love the phrase no is a complete sentence. It's like there's so, I mean I think there's so much power. There's so much power in no. There's also a lot of power in yes. There's
Yes.
as much power in yes as there is in no.
Yeah.
And I went to this workshop once where it was all women, and we were given the opportunity to practice our no's
Hmm.
and then practice our yeses. And I thought, oh, it's going to be a lot harder to practice my no's right, as a woman, and just like I've been socialized to not say no. And it turns out that no was not as hard as I thought it was going to be, because I've been really focused on practicing my no's. Like I've been really aware for a long time that no's are hard, can be hard. And and then we practiced our yeses, and I was like, I never do this. Like I never practice. I never, not never. That's silly, but it's I'm a lot less intentional about saying yes when something is really a yes. So anyway, it was interesting uh, to realize that actually for me, yeses is where I needed to like put more attention, which is of course related then to focusing on what you want.
Yeah.
So I'm very, very interested to hear about your thoughts on vision, your vision. So thinking about your vision for public health, your vision for health equity, how you see Black women shaping the future, and then of course your personal vision for your own future.
Yeah, my vision for public health. You asked this in August of 2025, when
I
the
know.
whatever vision took place has almost been shattered.
Yes.
But
I guess that, I mean, it is a good time to ask, I guess. Like we really need to go back to.
to address that piece, to
Yeah.
be to be very frank,
Yeah, please.
I, my vision, despite the fact that the administration is what it is, I still have hope. Not on the administration, but hope that what we're doing is bigger than this administration. Um, Going back to the courage question,
Yeah.
which again still is very much in alignment with what we've discussed, or what we're going to be discussing with the vision, is
Yeah.
I left my W-2 job around the time that we knew the results of the presidential election.
Yeah.
I had a few days of dilemma, like, is this the right time to leave?
Right.
Is this the right time to leave? Because we know what is likely to happen. We saw what happened in 2016,
Yep.
so forth and so on. And then I realized, well, I know a lot of people who started or already had a business, specifically Black women who started already had their own businesses in 2016 and beyond. And they are still here, and they are still doing well, and if even if they're not, they have a way to pivot to the next. They're not, it's not a story of despair one way or
Hmm.
the other.
Yes.
And so that encouraged me to continue on to do this, even though I don't know what it's going to look like. And quite frankly, now we're seeing that the jobs that we thought had the most stability in
Yes.
one day were gone.
Yeah. You're
So
right.
what are we putting our security in, if that is the, or what are we putting our hope and confidence in, if the most secure jobs can be gone that
Yeah.
easily? And so that is the reason why I believe that the vision, whatever the vision is for public health, goes beyond this current administration. I'm not trying to downplay the reality of the
Sure.
situation,
Of course.
but I also, I guess maybe this is my area of delusion. I don't know, but I do feel, I still feel hope, and if things course correct, or if it's a rebuild altogether,
Yep.
it will things will go in the direction that if towards good. Um, the same in my view with health equity. I feel that currently we're living in an upside down world where health equity is now equated to racism. Not true, but that's what the presidency, the administration is saying, and that is you know what you cannot do much about what the administration says, but that doesn't mean you have to stop the
Yeah.
work. And so I just feel that I still have hope.
You
I
still have
don't
hope.
know what it looks like. Like I said, it could be course correcting. It could be a rebuild. And I mean, I'm almost hopeful for a rebuild because
Yeah.
we can't necessarily, um, we knew that what was already happening, which is now being torn down, wasn't the perfect plan anyway.
Far from it.
So, so I just, you know, I'm hopeful
Yeah.
for a rebuild with the right people.
Yes.
As for me,
Yeah.
I'm going to have to continue to learn who I am and be who that in and operate in that way. I'm going to have to learn how to be courageous continually because there's courage in being who you are and not worrying about what who people think you should be. Um,
It takes courage to be courageous.
yes.
And
So
and I'm just going to go back and say you don't have to learn how to be courageous. Girl, you are courageous, but you get to keep being courageous.
thank you. And I mean, that's the energy because I just have to keep being courageous. I have to continue to have the energy to
Yeah.
stay in that way and not fall into a level of comfort. But it's almost like that conversation you were talking about with the no's versus the yeses.
Oh yeah.
You say yes to certain things and you suffer needlessly
Yeah.
because that is not what you were supposed to say yes to.
Yeah. Yeah. And so it's I've learned to focus on my yeses get to be enthusiastic yeses.
Yes.
If
Ex-
it's not an if it's not a hell yes, if I may, then it's a no. And also the energy that I bring to an enthusiastic yes, I get to actually bring the same energy to an enthusiastic no.
yeah.
Because a lot of times people are like, it's like, well, no, I mean, I can say no. It's like, no, I'm going to say no in the same way that I say yes.
Yeah. And so just learning more about, accepting my limitations as they are and saying no, because
Yeah,
that my business is my business and I'm not going to, you know, do electrical rewiring if that's not my skill set.
right.
So, same thing. If there's certain things I cannot do
Yeah,
or I don't feel like it's my zone of genius,
yes.
I'm not going to I'm not going to say yes just so that I can have a contract, but I
Yeah,
will say have the enthusiastic yes for the things that I truly enjoy. Qualitative work, uh, community centered work,
yes.
work around the determinants of chronic disease prevention and control. I love other topic areas, but considering nutrition, housing, education as it relates to chronic disease
Yeah,
is something that is really my passion and my area of expertise.
yeah. Son of genius. Son of genius. Oh, yes.
Yeah.
Okay, well, this has been such a great conversation, and so I don't forget to say this. Next time you're in San Francisco, you need to call me, and I will definitely like come over, and we'll meet up in person.
Yeah. We literally had just one day. It was a weekend, so it was literally Saturday. So the
Yeah,
thing we did was like very touristy stuff. Now that we,
yeah.
I will.
Good for you. Yeah, next time for sure. Um, so I want to make sure that our listeners know the best way to connect with you, so that they can learn more about you and your courage. which you
Thank
have
you.
a lot of courage.
Yeah.
So what is the best way?
The best way is either through LinkedIn
Okay.
or my website. My website has a link where you can schedule a call with me to kind of introduce ourselves and talk and learn more
Beautiful.
about one another
Yeah,
and share my experiences.
that's great.
Hmm.
So we will put the links both to LinkedIn and to your website in the show notes, which you can find on the website. Fantastic. What a pleasure.
Thank you so
Um,
much.
and we'll be in touch.
Okay. Sounds good. Thank you.
Thank you. Sometimes courage is choosing healing over hurry. Sometimes courage is leading with faith, trusting that love will guide the way. Sometimes courage is showing up for others while learning to care for yourself. Dr. Animashaun reminds us that true leadership begins within, that when we lead from healing and humility, we create ripples of hope that reach far beyond ourselves. You can connect with Dr. Animashaun on LinkedIn and the Amammere Consulting website to learn more about her work and her courage. All the links are in the show notes for episode 31 on our website, courageouspublichealth.com. Before you return to your day, take a minute to sign up for the weekly Courageous Public Health podcast email updates so you never miss an episode. You can do that on our website too at courageouspublichealth.com because there is more great stuff to come. Thanks so much for being here. Until our next episode, stay courageous. Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.